Hello everyone, I am Dr. Nitin. I am an orthopedic surgeon in Yashoda Hospital, Secunderabad, and I specialize in arthroscopy and sports injuries. Tennis elbow. I am sure you heard of this condition. It's a painful condition of the elbow. It affects the outside part of the elbow and it happens because of overuse, repetitive activities of your forearm or of the wrist. It affects not only sports people but regularly it is seen in middle-aged people, even in office goers, people who are at desk for long hours, it can affect. So what is this condition? It is a condition of the elbow where the muscle attaches to the bone. At that junction you start to develop pain. So every time you try to do any movements of the wrist, you have a pain on your elbow. Even trying to lift a small object like a water bottle or a mug can be very painful. So this is a very common condition. And how do we deal with this? In the first stage of the tennis elbow, majority of the treatment can be done at home with adequate exercises, with adequate physiotherapy, good nutrition, making sure your vitamin D levels are adequate, and with simple measures it can be treated at home. As the stage passes and if your exercises and physiotherapy does not help, we may have to do certain things like injections. And recently we also have developed stem cell injections which are helping a lot for tennis elbow. Sometimes and very occasionally we may have to do an arthroscopy or a surgery as a last resort for tennis elbow, but that remains extremely rare.
Hi, I'm Dr. Sumant, head of the department Physiotherapy. I'm specialized in musculoskeletal sports and manual therapy. So I was telling, it's a very painful condition. It mainly happens in the outside of your elbow. Here, the problem that happens with the patient is if he starts picking some weight, he starts getting some pain in the elbow. So for this, initially you should start doing some stretching exercises. First, you need to keep your elbow straight, and slowly you need to take your wrist down so that you should feel a very good stretch in your forearm, and slowly try to take all the fingers inside, okay, so that you will feel the furthermost stretch. Okay, you need to do these exercises taking your wrist up and a wrist inside, and while taking the wrist inside you should feel a good stretch. This stretch you need to maintain minimum for 10 seconds and repeat for 10 times. So if you are comfortable with this, and slowly we have to progress with the further stretchings, you need to hold your wrist with your other hand and try to push your wrist inside and to feel a very good stretch. So once this stretching protocols is done, then it is the time to start your strengthening exercise. For strengthening exercise, you can use a simple water bottle at your home. Okay, you need to hold your water bottle and slowly take your water bottle down. First you need to feel a stretch, and slowly, gradually you need to take your wrist up. Okay, while taking your wrist up, here the muscle starts activating and it is a strengthening protocol. And try to repeat this for 10 times. In a day, try to do it for 2 to 3 times. Okay, here we'll be doing the stretching and strengthening protocols. And here, and again the next thing is you need to keep your elbow and your forearm in mid-prone. This we say the mid-prone position. You need to do this, taking up and taking down. So next, take a weight and try to strengthen your brachioradialis muscle. Okay, brachioradialis muscle. And next thing is you need to hold a bottle this way, and with this hand, with the affected hand, try to take it this front and try to take this back, like how you are rinsing a cloth. Okay, that helps in strengthening your forearm muscles.
Brilliant. Just with those simple exercises, you can avoid the next stage of progression of tennis elbow. I hope this really helps you in avoiding further complications and getting rid of your elbow pain.